Hey everybody, my name's Rafi Salazar, or Raphael E. Salazar II, and I'm from ProActive Rehabilitation and Wellness, and I just wanted to tell you a little bit about the course that we've developed on the total shoulder replacement. So I don't know about you, but anytime that I go to any kind of healthcare professional's office and they discuss treatment options, usually what ends up happening is I get handed this giant packet of paperwork, right? And it's got all the treatment options in there. It's got potential outcomes, what to expect after the procedure, if it is going to be a procedure. And it can seem very overwhelming sometimes to be left with making a decision, especially about something like a total joint replacement, right? It's the shoulder and your arm, and it's very important for doing the things we want to do, right? So it can be very overwhelming to try to make those decisions on your own. So what we've tried to do here at Proactive is think about, okay, there are folks out there who may never come to the clinic, right? They might never be, y'all might not be in Augusta, Georgia, where we are, but we still have all this knowledge about total shoulder replacements, about orthopedic recovery, about pain, exercise, all of this kind of stuff. And we want to make that information available to everybody, as many people as possible, because I truly believe that the value that healthcare professionals provide is not necessarily the treatment techniques or the treatments and the exercises we prescribe to patients and clients. It's really the information that we have. I like to view ourselves as knowledge translators. So if you think about all of the vast medical knowledge that's out there, the wide breadth of technical knowledge that's available to us. I mean, you can do a Google search and read for hours and hours and hours about any kind of procedure. Total shoulder replacement is no exception. And it can be very difficult to try to wade through all of the literature. So what healthcare professionals like myself and my team members here, the value we provide is really the ability to kind of sift through all that information and break it down in a way that's easy to understand. So hopefully this course will do that for you. Maybe you're somebody that's considering a total shoulder replacement, or at your last orthopedic appointment or primary care appointment, the doctor said, well, maybe down the line you should consider doing a total shoulder replacement. So the goal here with the course is really three parts. The first part kind of is a high level overview of the anatomy. Okay, these are the pieces and the parts of the shoulder complex. The shoulder in particular is the most complex joint in the body because it allows for the most amount of movement. So as a result, there's four different components when we talk about the shoulder, and its ability to, say, go up behind your head or reach behind you. All of these different movements involve all four of those components moving and interacting well with each other, right? And then part two moves on to, okay, why might somebody recommend or consider a total shoulder replacement? You know, what are the factors that might go into choosing one type of shoulder replacement over another? And then the final part is, well, how do we prepare ourselves for total shoulder replacement? Are there exercises that we can do ahead of time? Are there things we can do to plan and prepare for that immediate time following you have the surgery? What happens for the first couple days afterwards? What are the things we need to be prepared for and have in place? And then typical recovery timelines, right? I'm required to say that this course in no way should be used in lieu of or considered medical advice for your own specific situation. However, we give kind of broad strokes and generalizations based off of the available literature and then my own experience as a clinician treating several hundred patients over the course of my career that have had shoulder issues and total shoulder replacements. So it's a three-part course, three different videos. It's about an hour-ish, give or take, maybe a little bit over an hour when it's all said and done. That covers, like I said, those three parts, kind of the anatomy, why you might choose or select a total shoulder replacement, and then which type you might consider, and then recovery and rehabilitation following the procedure, timelines for recovery, common precautions and limitations that will be in place at different phases in your recovery, and then ultimately the reason you're getting it done, right? The returning to your normal activities. So hopefully this course provides a little bit of context for you. I like to say we're demystifying the complexity of a total shoulder replacement. So Hopefully you will consider purchasing this course if you're on the fence about whether to get a total shoulder replacement or you're kind of just exploring your options. Until the next time, be safe, be healthy. I will talk to you then.